Hi, I'm the Director for Common Knowledge Trust, and although our New Zealand NGO focuses exclusively on passing on the birth and birth coaching skills that so many families developed in the early 1970s, fathers and mothers alike, we find ourselves at this very peculiar time, really, with me doing live Facebook talks about COVID-19. Um, Gee, what kind of a time is it? So I am the director of our New Zealand NGO, and I'm also a certified Buteco instructor. And I want to pass on one of the Buteco skills because it's helped me. I always had exercise-induced asthma, and when I would exercise, my breathing would be fine, and then suddenly I just would be hyperventilating and gasping for breath. So this skill is a skill that does not replace you going to the emergency ward if you have shortness of breath and think you have COVID-19. This is not a cure for COVID-19. This cannot eliminate COVID-19 virus. However, many of us feel really stressed. And when we're stressed, we stimulate our sympathetic nervous system, the part of us that causes us to feel fright, flight, fight, or freeze. And we need to stimulate the parasympathetic, which opens up our blood vessels, opens up the alveoli in our lungs, and helps us feel calmer. And Dr. Buteco developed this method, and this method was used to reduce all types of hyperventilation and panic attacks as well. So I want to teach this to you and have you learn it. It's going to seem very simple, and you're going to wonder, And on the other hand, it does work. So what you're going to do is repeat this 5 times. You want to just sit down, calm down. You can do it when you're walking. You can do this to develop better breathing when you exercise, as I have. But just sit down, calm down. And then when you're ready, you just breathe in normally and take a short exhale. And then you're going to pinch your nose and you're going to just hold your breath until you feel the slightest need to breathe, and then you're going to breathe back in your nose. So let's repeat this before we do it. You just breathe in normally, have a slight exhale, then you'll pinch your nose, and you just hold your breath until you feel the slightest need to breathe, and then you'll breathe in your nose. Now what this does is actually over time it collects nitric oxide in your sinuses. And that nitric oxide is also on our skin under the first layer of skin. And when we have sun on us, the nitric oxide glows bright white and it dilates our peripheral blood vessels. It's one of our great vasodilators. So it collects in here, and the reason you breathe in after you hold your breath is you stimulate that nitric oxide to go into your system. So we're going to do this 5 times. Now, each of us holds our breath for a different length of time. So I'm not going to hold my breath for as long as I can. And you want to breathe in your nose as soon as you feel a need to breathe. So this is going to look very short because I'm live on Facebook and we're going to do it together. You then have to do it yourself. Now, after 5 exhale breath holds, what are you going to feel? You may feel that your nose is not as blocked. And each time you breathe in, when you breathe in the nitric oxide and you bring it down into your lungs, you may feel warmth throughout your peripheral system. And you may find a little bit easier to breathe. Doing this, opening up your breathing, stimulates the parasympathetic nervous system, which creates calm. And what do we need to do now? We need to become calm. I'm a grandmother. I live alone. I'm in that risk factor. I'm a natural health practitioner. I am very skilled at taking care of myself. However, I have 2 children, and those children have children. And I have friends and neighbors. And all of us want to get through this without tearing our hair out, feeling horrible. And one of the ways to do that is to stimulate the parasympathetic nervous system. So let's do this together. We're going to just have a normal breath in and a slight breath out and pinch your nose. And then breathe in your nose. And you may not feel the nitric oxide yet, but just let it come in. And then you just do nose-nose breathing until you feel you can do it again. And you just take a regular breath in, slight breath out. Breathe in, let the nitric oxide come into your lungs. So obviously you're going to do this to you. I'm doing it because I have to present this to you. So it's not that you're following my speed, it's you're doing it at your own speed. You should not feel any stress of breathing before you breathe in your nose. Okay, so we're going to do it again. Just normally breathe in, slight breath out. Breathe in. Return to normal breathing. At some point you may feel, because I've done this a lot in my life, I can feel that my nose is already unblocking because I've trained my body by doing this. You can do it sitting, standing, lying, moving. If you start to do it moving, then you're getting into the oxygen advantage side of this, which is sports performance. So we do one more time. Normal breath in, small breath out. Can't even see it. Pinch your nose. Breathe in. And your breathing should be absolutely normal. Now, some people who do this actually has a name. It's called unblocking the nose. When they exhale and hold their breath, sometimes they nod or rock like that. It's just a distraction, right? It doesn't make it any better, right? So after 5 times, try to go back to nose-nose breathing. Notice how you feel. As you do this over time, this stimulates the parasympathetic nervous system, which is calming. It opens up your blood vessels. It opens up the alveoli in your lungs. Dr. Buteyko was transformative in dealing with all forms of breathing problems. He's known about asthma, COPD, all sorts of panic attacks, hyperventilation. He is world-renowned. It went against the grain of modern medicine that believed that hyperventilation was the resulted from breathing difficulties. And Dr. Buteyko said, if we can decrease our hyperventilation, stimulate the parasympathetic nervous system, open the blood vessels, open our lungs, then we will breathe more calmly. He's a strong advocate of nose-nose breathing, not nose-mouth breathing. But there's a more scientific part of this. I do not have a scientific background, so all of you that do can understand it. When people have shortness of breath, they feel they're not getting enough oxygen, and so they hyperventilate. The reality is if you put an oximeter on them, they are getting enough oxygen usually, and you can't get more. And what happens with the oxygen is that it sticks to our red blood cells. We have another gas in our body beside the nitric oxide, which is called carbon dioxide. This method of breath holding and being able to calm your breathing, slow it down, breathe more softly and comfortably, stimulates the tolerance for carbon dioxide in our body. Now, when I first became an instructor, this was very hard for me to understand because it was presented scientifically and I don't have that background. So I've interpreted it more moderately. So when we have high oxygen in our body, the oxygen molecules stick to our blood vessels, our hemoglobin. But when we have a higher carbon dioxide tolerance, that liberates the oxygen from our blood cells and sends it out to our organs and our muscles. This is why high-level athletes are not as breathless as most of us because they have a high carbon dioxide tolerance, which is liberating their oxygen and sending it out to their organs and their muscles so they don't get fatigued as quick. They don't get the lactic acid as much. So many of us who are hyperventilators get panic attacks or have asthma, exercise-induced asthma, COPD, or other pulmonary breathing problems. We get fatigued much faster because we don't have a high tolerance for carbon dioxide. So the oxygen stays in our blood cells and it doesn't get out to our organs and our tissues. So remember, this is a very simple thing to do. You can teach it to your children. You can do it together as a family. It stimulates the parasympathetic nervous system. It helps us feel calmer. In this time, we need more calm people. Thank you very much for listening to this. And Buteco has YouTube channel. He's got many videos out there. There are a lot of Buteco instructors out there. We're doing this through our New Zealand NGO Common Knowledge Trust. And as the director, I'm just trying to share common knowledge, common sense skills that you can use for yourself, among your friends and family, in the privacy of your own home. I'm in total lockdown in New Zealand, so until the 23rd of April, this is where I am. Do I get stressed about this? Yeah. So using this technique is very good. If you're an athlete, what you want to do is do the breath hold until you feel an urge to breathe in. Then breathe in your nose, and within 6 breaths, you want your breathing to get calm again. But the more you do this, particularly if you're out running or walking, you will increase your carbon dioxide tolerance and send your oxygen into your muscles and your organs. If you're having trouble breathing, try doing this. But remember, this is not a cure for COVID-19. This is not an alternative medicine thing. If you feel you have COVID-19 and you have shortness of breath, go to the emergency ward. Period, full stop. All right, take care. Thank you very much for listening.